Hello everyone, welcome to Lump Lecture Series featuring scalp acupuncture. Today we will talk about head imaging scalp acupuncture or the Fang Scalp Acupuncture. Dr. Yun-Peng Fang of Xian, China invented head imaging scalp acupuncture in 1976. He used his clinical experience based on the brain reflex on the scalp area to develop Shanxi head imaging scalp acupuncture. This system is an image of the human body lying on the top of the scalp area. This system uses the coronal suture, sagittal suture, and lambdoid suture and corresponds as prone imaging to the human body's head, upper arm, body trunk, and leg area. The middle point of the anterior hairline to the corner of the forehead corresponds to organs of the human body's upper jaw, middle jaw, and lower jaw. This system mainly consists of prone imaging, prone organ, inverted imaging, and inverted organ, as well as the cerebral representative area of brain function. The scalp acupuncture point name is based on the central nervous system, as well as traditional Chinese medicine holistic theory. Head imaging scalp acupuncture has the functions of stopping pain and releasing spasms, calming the shen, reducing blood pressure, and relieving itching, and it can be used for emergency care. The technique is most effective with oblique or perpendicular insertion combined with turning and rotation techniques. There are two standard lines that are used to locate cerebral areas and points. One is the eyebrow vertex occipital line. This line runs along the sagittal suture, connecting the midpoint between the two eyebrows, the vertex, and the lower border of the tip of the external occipital protuberance. This is a divided line that separates the cerebrum into two parts, left and right. In most adults, this line is about 33 centimeters in length and is also called the 33 portions, based on different sexes, ages, and human body size. Second is the eyebrow-ear occipital line. This line runs horizontally across the lateral side of the head, connecting the midpoint of the superior border of the eyebrow with the tip of the external occipital protuberance. The cerebrum is located above this line, and the cerebellum is located below this line on the posterior one-third portion. In most adults, this line is about 26.4 centimeters in length and is also called the 26.4 portions. It is called the eyebrow occiput line in the Jiao scalp acupuncture system. Point locations and indications. Prone imaging. Prone imaging uses scalp landmarks such as the coronal suture, sagittal suture, lambdoid suture, and bony structures to create an image of the human body as if it were laid out face down on the top of the head. Prone imaging represents the motor nerves of the body, also called the motor center. Acupuncture needles are used on this area to treat whole body disease, especially of the motor system, nervous system, and cardiovascular system. Coronal suture imaging corresponds to the left and right upper arms. Sagittal suture imaging corresponds to the trunk area. Lambdoid suture imaging corresponds to the left and right legs. Bregma corresponds to the area between the neck and cervical vertebrae. The anterior part of the bregma corresponds to the neck and head area of the human body. The lambda area corresponds to the sacral tip area of the human body. From bregma along the coronal suture to the greater wing of the sphenoid bone is 11 centimeters. From bregma to lambda is a total of 14 centimeters. From lambda to the upper border of the mastoid process is a total of 9 centimeters. The head and neck are 3 centimeters anterior to the bregma area. The head is 2 centimeters wide on both sides, and the neck is 1 centimeter wide on both sides. From bregma to the upper border of the greater wing of the sphenoid bone is the upper arm. The neck to the shoulder is 2 centimeters long. The shoulder to the elbow is 3.5 centimeters long. The elbow to the wrist is 3.5 centimeters long. The wrist to the tip of the hand is 2 centimeters long. From bregma to lambda is the body's trunk, which includes the back, lumbar, and buttocks. The back area is divided into 3 2-centimeter long portions called the upper, middle, and lower back. The lumbar is divided into 2 2-centimeter long portions called the upper and lower lumbar. The buttocks are divided into 2 2-centimeter long portions called the upper and lower buttocks. On this entire vertical line, the upper back, which is between the shoulders, is 4 centimeters wide. The middle and lower back, which is the chest area, is 3 centimeters wide. The lumbar is 2 centimeters wide, and the buttocks are 3 centimeters wide. From lambda to the superior border of the mastoid process are the legs. Lambda to the hip is 1.5 centimeters long. The hip to the knee is 3 centimeters long. The knee to the ankle is 3 centimeters long. The ankle to the toes is 1.5 centimeters long. Prone organ reflects the sensory nerves of the human body, also called the sensory center. It is mainly used to treat the internal organs or skin and muscle sensory disorders such as pain, touch, cold, heat, numbness, or itching. The area from the anterior midline along the anterior hairline to the corner of the forehead is divided into 3 parts: the upper jaw, middle jaw, and lower jaw, for a total of 6.5 centimeters. Upper jaw refers to internal organs above the diaphragm. It also includes the sensory area of the arms and chest, as well as the thoughts of the brain. Its total length is 3 centimeters. Thought, close to the frontal crest on both sides. Head and neck. First 2/3 of the upper jaw area, 0.5 centimeter from the anterior hairline, extending downward, and 1 centimeter extending upward. Upper arm, point A, 2 centimeters lateral from the anterior midline and 2 centimeters extending upward from the anterior hairline. Point B is 1 centimeter lateral from the anterior posterior midline and 3.5 centimeters extending upward from the anterior hairline. The line from point A to point B is the arm, divided 0.5 centimeter each for the upper arm, forearm, and hands. Middle jaw refers to the internal organs between the diaphragm and umbilicus. It also includes the sensory area of the trunk. Its total length is 1.5 centimeters. Lower jaw refers to the internal organs below the umbilicus. It also includes the sensory area of the abdomen and legs, as well as the urogenital system. Its total length is 2 centimeters. Lower abdomen, buttocks, hip, and upper leg area. It is 1.5 centimeters long and is located at the anterior portion of the lower jaw area. It extends 0.5 centimeter downward and 1.5 centimeter extending upward from the anterior hairline. Knee, lower leg, and ankle area. It is 0.5 centimeter long and is located at the posterior portion of the lower jaw area. It extends 1 centimeter downward and 2 centimeters extending upward from the anterior hairline. Feet. 0.5 cm posterior to the lower jaw area. It extends 1 centimeter downward and 0.5 centimeter posterior. Inverted imaging and inverted organ are an important part of Fang Scalp Acupuncture. They are based on the functional location of the cerebral cortex associated with the motor and sensory areas. The precentral gyrus of the frontal lobe and the postcentral gyrus of the parietal lobe reflect an image onto the scalp. Modern medicine has proven the functional location to be similar to an upside-down fetus. This means that the head is down, and from bottom to top will be the head, neck, hand, upper arm, trunk, lower leg, and foot in that order. This is called inverted imaging and inverted organ because the image of the fetus is upside down. Anatomical motor center, located on the precentral gyrus of the frontal lobe. Scalp location. Point A is located 1.25 centimeters posterior to the midpoint of the eyebrow vertex occipital line. Point B is located by finding the point 1.25 centimeters anterior to the midpoint of the eyebrow ear occipital line and drawing a vertical line 4 centimeters in length superiorly. Point B is at the end of this line. Connect points A and B to locate the central sulcus. The inverted imaging of the motor region is located 0.75 centimeters anterior to the central sulcus. This line is divided into 3 portions. The first portion is the bottom 1/3 and includes the throat, tongue, jaw, eyes, head, and neck in that order. The second portion is the middle 1/3 and includes the fingers, wrist, elbows, and shoulders in that order. The third portion is the upper 1/3 and includes the upper, middle, and lower back, hip, and leg in that order. Indications: contralateral motor function disorders of the trunk, arms, and legs, such as paralysis, motor aphasia, wry neck, sprained ligament, periarthritis of the shoulder, concussion, sequelae of brain injury, Bell's palsy, and seizures. Anatomical sensory center is located on the post-central gyrus of the parietal lobe. Scalp location: 0.75 centimeter posterior to the central sulcus and parallel to the inverted imaging area. This line is divided into 3 portions. The first portion is the lower 1/3 and is called the upper jaw, which includes the internal organs above the diaphragm, teeth, tongue, throat, eyes, and head. The second portion is the middle 1/3 and is called the middle jaw. which includes the internal organs between the diaphragm and umbilicus, as well as the thumb, fingers, and the arm, in that order. The third portion is the upper one-third and is called the lower jaw, which includes the internal organs below the umbilicus, as well as the back, hip, and leg, in that order. Indications: internal organs and body contralateral sensory disorders such as pain, temperature, touch, and itching, which include coronary heart disease, arrhythmia, palpitations, salivation, migraine headaches, edema, eczema, hives, stomach pain, diabetes, dysentery, dysmenorrhea, spontaneous sweating, deafness, polyneuritis, and sciatica. Functional regions imaging. The cerebral cortex is the adjusting center, and its functions include the control and management of other organs and tissues of the human body. In addition to the motor and sensory centers, there are other functional centers distributed to different areas of the cerebral cortex, and each one is in charge of different functions and activities of the human body. Based on these functional center distribution areas, scalp acupuncture developed many stimulation areas that are used for acupuncture manipulation. The thought: anatomical location at the anterior portion of the frontal lobe. Scalp location between the frontal eminences, 3 centimeters above the in-tongue point. Indications: this area controls the functions for intellect, complex learning abilities, and personality. It is necessary for the production of abstract ideas, judgment, reasoning, persistence, planning, and concern for others. Used for patients with mental deficiency or poor intellectual development, Down syndrome, ataxia, hysteria, schizophrenia, hypertension, and insomnia. Anatomical location of the speech area is located on the inferior and anterior part of the precentral gyrus and opercular part, triangular part, and orbital part of the inferior frontal gyrus. It can be found at the greater wing of the sphenoid bone. It occurs on the left side for people who use their right hand, but on the right side for people who use their left hand. For some people, it occurs on both sides. Scalp location at the midpoint between the eyebrow and the apex of the ear. Indications: the function is to direct the muscles of the tongue, throat, and lips. It can treat motor aphasia, dysphonia, and tremulous tongue. The signal: anatomical location located at the posterior one-third of the superior temporal gyrus of the temporal lobe, abutting the lateral sulcus, closer to the auditory association area. Hearing and memories of sounds heard in the past appear to be stored here. Scalp location: a point is located 3 centimeters above the external occipital protuberance. Connect this point and the ear apex, and the signal area is found at the midpoint of this line. Indications: nominal aphasia, epilepsy, insomnia, and maldevelopment of the brain. The written area. Anatomical location: at the posterior part of the superior frontal gyrus, middle frontal gyrus, and upper part of the precentral gyrus. The functions include controlling learned motor skills of a repetitious or patterned nature, and it is the memory bank for skilled motor activities. Scalp location. It can be located on the scalp by starting at bregma and drawing a line backward at a 45-degree angle with the sagittal suture on both sides. It is 3 centimeters from bregma. Indications: dysfunction of writing, hypertension, and tremulous hands. Anatomical location. The memory center is located on the angular gyrus of the inferior parietal lobule. Scalp location. It is located on the scalp by drawing a line from lambda in the anterior inferior direction on the left and right side at a 60-degree angle with the sagittal suture. The point is 7 centimeters from lambda on both sides of the line. Indications: dizziness, decreased memory, and sequelae of cerebritis. Auditory area. Anatomical location. Located in the superior margin of the temporal lobe, abutting the lateral sulcus, closer to the primary auditory area. Scalp location. It can be located on the scalp 1.5 centimeters directly above the ear apex. Indications: nerve deafness, tinnitus, and abdominal distension. Smell and taste areas. Anatomical location. Smell is located at the hippocampus and dentate gyrus of the limbic lobe. Taste is located at the hippocampus of the limbic lobe and the lower part of the postcentral gyrus. Scalp location. It is located on the scalp directly above the ear apex, 3 centimeters anterior to the ear apex. Indications: decrease or loss of taste and smell, and acute or chronic sinusitis. Balance area. Anatomical location. At the cerebellum immediately below the occipital lobe. Scalp location. It is located on the scalp 2 centimeters below the external occipital protuberance and 3.5 centimeters lateral from the midline. Indications: dizziness, ataxia, and nystagmus. Usage area. Anatomical location. On the superior parietal lobe. Scalp location. It can be located on the scalp by starting at the lambda area and drawing a line anterior to the left and right with a 30-degree angle to the lambdoidal suture and 5 centimeters from lambda. Indications: apraxia and ataxia. Breathing and circulation area. Anatomical location at the medulla oblongata. Scalp location. It is 5 centimeters below and 4 centimeters lateral to the external occipital protuberance. Indications: arrhythmia, rheumatic heart disease, coronary heart disease, asthma, and hypertension. Anatomical location of the vision area. At the posterior tip of the occipital lobe. The right half of the visual space is represented on the left visual cortex, and the left half is on the right cortex. Scalp location. It is located on the scalp 2 centimeters above the external occipital protuberance and 1 centimeter lateral. Indications: visual disturbances, cortical blindness, and papilledema. Thank you very much for your attention and hope to see you in our next videos.